Isaiah is 8. He was first diagnosed with spastic cerebral palsy, triplegia, meaning 3 of his limbs are affected, in 2008. I didn't know much about cerebral palsy. I was frightened. I was scared. My husband and I, we were devastated. Well, after the diagnosis, we actually got him into OT, PT, speech, different types of therapies because he had issues in all those areas. In our country, there were some limited services, but we certainly didn't know about all of these different things. The Botox actually presented itself at that time, but we could not take advantage of it because to do so, we'd need to stay in America over a long term. One of the things I want other parents to know is it's not a one-off. You've got to do this every 3 or 4 months. But also, it doesn't just work on its own. It's not a miracle cure. You've got to work intensely, like we've worked with Isaiah intensely, to see the things that we now see. Being able to use a walker, even though it's just a few short steps at a time. Being able to stand up a bit longer periods. Even just get into a standing position more comfortably. I was actually referred by some therapists downstairs from Florida Hospital. I said, we're here now, we've transitioned, I want Isaiah to get the Botox and going. And coming into a strange environment, you don't know who the best is. So we came to Florida Child Neurology, and immediately I was smitten with Dr. Barr's demeanor because he's gentle, he's approachable. Sometimes in the past, I may have dealt with different physicians who, they kind of brush you aside, they brush your issues aside, they hurry you up, they just want to get on to the next client. But what I found with Dr. Barr was he has a very soothing disposition. Even in terms of calming Isaiah for the shots, because the Botox are given as a series of shots. And nobody likes shots, and children especially. But what I've noticed is over the time we've been here, he's become a lot calmer. So the thing is, we've come to Florida Child Neurology not just for the Botox. We've also done EEG services, we've done checkups and such. And whether it was Dr. Kothwala that was dealing with Isaiah, whether it was Naomi, who was very personable and sweet, and she would get on the floor as required. And one of the things that really strikes me with Dr. Barr is that he isn't just willing to rush on and get it done or move on to the next patient. He addresses the concern. And I think that if parents continue to get that kind of support, you are much more willing, you're much more involved, you're much more integrated. You feel a sense of community when you come in, and not just, I'm a client, I'm bringing some money here, I'm bringing some business here. But there's a sense that Isaiah as an individual and his dignity and his growth and his development are important in the bigger picture. And that mirrors the value system I have and my husband have for him and the type of treatment we want him to get. Don't give up. You're not going to just see the results necessarily in one shot or one dose. It's a procedure that you've got to do repeatedly, but it brings results because we've been doing it now for almost 2 years. And believe you me, the progress we've seen in 2 years in terms of him being able to position his right foot, in terms of him being able to bear weight. And part of the joy of it is the dignity that he has and the pride he has in himself, being able to do a bit more for himself and not depend on us as much as he used to when he was smaller.